Now, what is stridor? Write down, beta. Stridor is the noisy breathing. So it is noisy breathing. Why there is noisy breathing? Because of the narrowing of the airway. So now stridor basically it is divided into two types, or broadly speaking it is classified into three types depending upon the level of obstruction. So write down, beta. Type of stridor and the level of obstruction. So if it is inspiratory stridor, there are two phases of respiration, that is inspiration and expiration. So if a stridor is occurring in the inspiration, it is known as inspiratory stridor. So inspiratory stridor, the level of obstruction is at the pharynx and the supraglottic part of the larynx. And if it is biphasic stridor is when the stridor is happening both in inspiration as well as in expiration. So the level of obstruction is at the glottis, subglottis and the cervical trachea. However, if it is at the in the expiration phase, it is known as expiratory stridor. Now expiratory stridor occur when there is the level of obstruction is thoracic trachea. So thoracic trachea and the primary bronchi. So these are the type of stridor. Just to revise, what is stridor? Stridor is the noising breathing. So noising breathing occurs when there is a narrowing of the airway because of any infection, because of any malignancy, because of any trauma. So depending upon the level of obstruction, the type of stridor has been described. If the stridor is occurring in the inspiratory phase, that means the level of obstruction is at the pharynx or in the supraglottic part of the larynx. If it is occurring in both the phases of respiration, then the level of obstruction is at the glottic or at the level of supraglottic, subglottic or at the level of cervical trachea. Whereas if it is occurring in the expiratory phase, so in the expiratory phase it can occur if the obstruction is at the level of thoracic trachea and at the level of primary bronchi.